Good morning. Thank you for everybody that is here today. I really appreciate it. I am Councilwoman Laura Pastor, and I actually want to consider myself a first responder in the sense that I'm trying to save lives. And that's what we do with our program, is saving lives. As many of you know, I kicked this off about 9 months ago. And we, at that time, were welcome first responders to get cancer screenings. It was in the month of November, I want to say. Yes, it was in the month of November, and we had invited all our first responders to come in and go to Vincere and work with Dr. Pritchard and Dr. Shukla on cancer screenings, and really encouraged everybody to go in. Well, to my surprise, many did. And to my surprise, and actually it shouldn't have been a surprise, but it was, many lives were saved. And so I'm very grateful for that. And we are moving forward and expanding. And I am going to invite Dr. Shukla and Dr. Pritchard to speak about their work. Thank you.
Hello, I'm Vincere Shukla, radiation oncologist at Vincere Cancer Center. Thank you, Laura, and thank you to all the first responders for participating in our cancer screening program. I'm honored to be here to discuss our results. So since November of 2018, I've screened 164 first responders. 132 were from fire and 32 were from police. Their age ranged anywhere from 27 to 76, with the average age being 50. And the years of service were anywhere from 4 to 40, with the average being 24 years. We screened for lung cancer with low-dose lung CT. I did 141. Prostate cancer with clinical exams and blood work, we did 33. Breast cancer, mammogram, and ultrasounds, we only did 2. Skin cancer with clinical exam, 55. Genetic testing, which is a blood test, we did 24 of those, and colonoscopies, we did 44. From this, I'm really happy to report from all my colonoscopies, there was no colon cancer. My mammography and ultrasound, there was no breast cancer. We diagnosed 2 prostate cancers, but both were diagnosed early, and those patients are choosing their treatment options right now. We did 2 genetic mutations, and so what does that mean? Those first responders and their family members can choose or now get more early screening and more aggressive screening for the certain types of cancers they're at risk for. We diagnosed 2 skin cancers, both have had surgeries, and so they're done. And then finally, for the lung, so we did low-dose lung CT. I picked up 41 lung nodules. One was large enough that we surgically excised, and it was cancerous. But we were lucky, again, because it was picked up so early that first responder didn't require surgery or radiation. And so I just briefly want to talk about lung screening. So low-dose lung screening it's basically a CT scan, but it picks up nodules 1 to 2 millimeters. And it's the same radiation as a chest x-ray, so it's safe to do in the mass population. So chest x-ray picks up a nodule at 1 to 2 centimeters, so the tumor is 10 times bigger on a chest x-ray. The current screening guidelines for low-dose CT are for smokers who've smoked for 30 years, or for ex-smokers who've smoked for at least 15 years and are at the age of 55. There are no occupational guidelines for lung screening. And ironically, 30% of lung cancers in this country are diagnosed from occupational risk, and only 20% of lung cancers are diagnosed in smokers. So when I started the screening, I started following the current recommendations. So I was looking for first responders with 30 years of exposure, or at least the age of 55. But what happened is people from Chandler came in and kept telling me, well, Dr. Shukla, my fire captain died very young, so can you screen me, can you screen me, can you screen me? So finally, I opened it up at the age of 40, and I started screening at the age of 40. And I'm really, really glad that I did, because over half of the lung nodules that I picked up are under the age of 55. And so what does that mean? Majority of these are probably going to be benign, scar tissue, valley fever, but at least I have the opportunity to follow them, and I have the opportunity to follow them safely. And so, but it also gave me the best story, or the best possible outcome from the screening. And with that, I'd like to introduce Jason Underwood from Chandler Fire.
This is a huge honor for me to be here, and I appreciate everybody coming. Like Dr. Shukla said, we had a death on the department, mid-50s, young guy, great shape, everybody loved him, and kind of shook us. We had the opportunity through the cancer screening program to get checked out, give us some peace of mind, and hopefully not find anything, but get everybody a clean bill of health. And well, I didn't. They went through some screening. Fortunately, the criteria was changed to 40. I'm 42 years old, pretty active. And they sent me in for screening, CT, called me a few days later, said, hey, we found something. We need to get you in for another screen. Went into the PET scan, came out, and it was hot. It was I wouldn't want to say very aggressive, but it was a lot more aggressive than anything should be in that general part of the body. They found a tumor pretty much right in the center of my chest, right next to my heart, lungs, aorta, some pretty important nerves. And the good news was we caught it early. We caught it at what I believe is like the very beginning stages. I didn't have any symptoms. I didn't have any indications that I should go in and get checked out. I just went in to get a clean bill of health. And so then, fortunately, being that aggressive in the screenings and being able to have that access for us helped us find it early, which resulted in I personally think it was an awesome outcome, because I'm standing here talking to you. But it was one surgery. Cut it out. The margins were pretty big, so to me that means it didn't spread, and it had an opportunity to spread had we let it go on further. And typically this cancer that I had doesn't get found till later because of the lack of major symptoms and things like that. So yeah, I'm just happy to be here. I'm happy to speak on behalf of Dr. Shukla, Vincere Cancer Center, Councilwoman Pastor. Thank you so much for being aggressive and proactive in being able to provide these screenings. My biggest message that I've been telling friends and coworkers is that go in and get screened. If you need someone to pay for it, we'll find a way to pay for it, but it could save your life. And now I'm cancer-free. We'll do some follow-ups, but everything's good. I'm back on a truck and back to work, back to running. So thank you very much for coming. And anything else I can add?
Thank you, Jason. And good morning, everybody. Thank you so much for coming out to the Phoenix Fire Training Academy. Jason is a prime example of why we're doing what we're doing. I mean, you look at the guy, he's a young, healthy athlete. The guy does extreme athletes. I mean, he runs super marathons, ultra marathons, and this is the last kind of guy that you would expect to have cancer. And he did. He's at higher risk, and we need to be screening for this population. We've been overwhelmed by the support that we've gotten from the city for this first responder screening program, namely Laura Pastor, thank you very much, and of course the chiefs, Chief Kalkbrenner and Chief Williams. They've been amazing in their support. Not only are they showing leadership in getting their departments to get screened, but they've actually shown leadership by example and actually gotten screened themselves. Thank you. Also wanted to mention Michael Peterson in Kovaya. Michael, he has been instrumental in helping us navigate the system. Thank you, Michael. We at Vincere would like to announce continuation of the successful first responder screening program and building it bigger and better. Building it bigger in that we are partnering with cities across the country to have a nationwide rollout. We are continuing the local program so that we have First Responder Fridays, and we'll continue that out throughout the year. And then better, as we are incorporating some new screening techniques and therapeutics. One of the new tools that we are incorporating is QT ultrasound. Like Dr. Shukla was mentioning earlier, it's the low dose CT scanner is so important in the lung screening because of the low dose of radiation they get. In QT ultrasound, you have no radiation, unlike a mammogram where you have radiation, and there's no contrast, unlike a MRI where you have contrast. QT ultrasounds give a MRI quality image without having any negative effects to the breast and soon full body. We have seen an increased risk of breast cancer in first responders, both male and female. Actually, there was so far 15 male first responders with breast cancer that responded to the 9/11 site. QT has donated many screens to help us screen and diagnose and study these breast cancers in first responders. First responders now have 17% of females in large cities, and these women tend to be younger and have denser breasts. Mammograms are kind of more meant for somebody who's a little bit older and their breasts are less dense, but because we're seeing breast cancers in younger and younger populations and first responders are at a higher risk, we needed a system to screen for a younger breast. QT ultrasound has a much better ability to look through this younger, denser breast tissue and find a tumor. And it also has a better ability to look around implants. We are also incorporating our partnership with the Deepak Chopra Center. First responder jobs, as you know, are highly stressful. Stress increases your stress hormone, cortisol. And this increase in cortisol can affect your immune system in a negative way. You need to have a healthy immune system to not only prevent, but also treat cancer. And so the Deepak Chopra Center uses multiple techniques, including meditation, yoga, Ayurvedic therapies, and grounding that help with our first responders' needs. With that, I'd like to introduce Patricia Hacker from the Deepak Chopra Center to tell us more about this program.
Hi, it's an honor to be here. Thank you. And I'm one of the co-founders of Deepak Chopra Inner Space, where the mission is to ground and meditate as many people possible to help reduce the inflammation in both the body and the mind. The grounding technology is very simple. It just connects into the grounding port of an outlet, and through the negative charge of the earth, it reduces and neutralizes the inflammation in your body. And then coupled with meditation, it helps ground the mind. And we're excited to announce by the end of this year, we will have grounding meditation centers in 59 firehouses, 16 precincts, and the police trauma van. So we're, on behalf of Dr. Chopra, all excited, very excited to be part of all of your organizations.
So at this moment, I will bring up the chiefs. Chief Kalkbrenner and Chief Williams, can you talk about your experience?
Thank you, Councilwoman Pastor. Your leadership for public safety, health, and wellness is something I've never experienced before, and I couldn't be more proud of what you've done for our first responders. Dr. Shukla, Dr. Prashad, thank you very much, and this wonderful doctor over here is also involved in it, so thank you for your participation. You know, we were here back in September, and we talked about the atrocities that firefighters and police are facing to the calls that we go on. You put a blue shirt on and become a firefighter, your risk of cancer raises 25% by taking an oath and putting on a blue shirt and fighting fires in our community. We've noticed this over the last several years. We had a fatality in January from a firefighter who had late-stage cancer and passed away early January, and we have another one that is in stage 4 with extreme melanoma that's metastasized throughout his entire body. So this is something very dear to me in the city of Phoenix, and anything we can do to help prevent, which is my job and my team's job, to make sure they have the equipment, resources, and training for prevention. But more importantly, these exposures happened some time ago. So they've already had the exposures, the carcinogens already live within their body. These wonderful people now are given the opportunity to go and get early detection, which means early diagnosis, detections, and get it cured. So I couldn't be more proud of what these folks have done for us. I will be beholden to them for my entire career, and the entire City of Phoenix Fire Department, as well as Chandler, Mesa, Glendale, Peoria, all of our automatic aid partners are also involved in this. So just a huge thank you to the community and your support. Thank you to the media for your support to be here. And then in closing, I would just like to mention the farm. We have some folks here from the farm, because one thing in the fire service as well as the police department, we're finding PTSD is real. And we have firefighters as well as police officers, I can't speak for Jerry, but that are suffering from this. We have a retired fire captain who's actually with us today, who has experienced PTSD, has gone through the farm and gotten healed, and he's on a path to recovery. And I couldn't be more proud for him sharing his story, and he wants to make a difference to help other first responders. So it takes a village, it takes a community, and this is amazing what these folks are doing. And all the folks behind you that are here with sharing some of their tools to help us. They're here on their own time. They're making donations. Chopra Center, thank you, Dr. Chopra, for what you've done. These grounding stations, they gave them to us to use. We've had success with them, and now through a donation or a grant, we're going to be able to get them at all of our fire stations as well as our police precincts. So again, a big thank you.
I don't necessarily think I wanted to follow Chief Kalkbrenner today, so thank you so much to the Vincere Center, to Laura Pastor for the leadership and the visionary. Who else is going to come up and say, hey, let's just try something new? So you challenged us. We appreciate the challenge, and you all, thank you so much. When you walk into the Vincere Center, it's different than going into a normal doctor's office. It's serene, it's very calming. So we would invite any members of the media to please go out and see. I'm just inviting them to your place. Go out and see. But the biggest benefit are the lives that are being saved. The biggest benefit are the opportunities that we're creating for our public safety partners all over this county in order to find out what they have and figure out a way to get it fixed. So we're proud of this effort. I'm proud to be standing here with Chief Kalkbrenner, as well as all of our community partners. Please, please, please come out. It's an amazing facility. Although I didn't make it out to the farm, I'm really looking forward to the opportunity to go out and see. But thank you so much, ma'am, for your leadership, to Laura Pastor. Thank you.
So I want to thank everybody for being here, because this is important work that's happening within our community. And I'm going to say Copy, I hope I said it right, Farms, for the work that you're doing also in PTSD, as well as the Deepak Chopra Center. What this means is it's really about wellness. And what does wellness look like in our lives? Every one of us has a hectic life. Every one of us has responsibilities, raising a family, having kids, having parents, elder parents, taking care of parents, and sometimes we just don't understand the stress that we're under and our body is under. We think we can get up and move and go, and all of a sudden we get a little tap on our shoulder saying, hey, this is what's happening within your body. Well, we can do better, and the way we do better is by collectively, in a holistic way, do better for ourselves and others within the community. And that means to reach out and do the things that we need to do, which means eat well, so that's wellness. It's also keeping your mind fresh, rested, meditation. It also means about your body, doing the work that needs to be done in the sense of walking, working out, doing the things that you have to do. But it's also taking care of your body and your internal body by getting the tests that are needed. We also and wellness and mind witness a lot of things that we don't realize that we're suffering from PTSD. And so we, as a collective, have to recognize that we suffer PTSD in many different forms. And so we have to be able to talk about that and be building a community to be able to share and learn and move forward and understand what we're dealing with. So once again, I want to thank everybody here. We're all in the middle of this journey. I appreciate everything that everybody's doing with our effort, and we have more results, happy results to see and be able to move forward. So thank you once again for being here. Appreciate it.